We're in part 3 now, and we just did the foramen ovale, the foramen rotundum, ovale, and spinosum, little 1, 2, 3. Let's take a look at that right here. It's right here, and right here. And right here is the rotundum, and that's going to be trigeminal. Part 2 is the maxillary. Then we're going to have the ovale. This is the ovale. So trigeminal part 3, that's the mandibular. And then we're going to have spinosum, which doesn't have a little pointer in it, but it is right here, sort of behind that stirring rod. Now the next one we're actually inside the carotid canal, which is right here and also right here. I don't have a stirring rod in it. And it's a complex system, and I'll sort of try to show you in this diagram what's going on. The carotid canal, we were just speaking about it in this last part. The internal carotid artery is going to flow through there, and it's going to flow from the back of the skull toward the front of the skull. Okay, so there's an opening at the bottom of the skull, further and back, and then we have a horizontal part of this little tube or canal through which the artery flows, and then it goes up, and then it divides into the anterior and middle arteries of the brain. Okay, and we're going to also notice that there is this cartilaginous area here that gets cooked out in life. But I'm not crazy that you know the name of it. It is called the Foramen Lacerum. And it's, how shall I say, a somewhat overabundance of excitement and detail on the part of the anatomist that they actually go around naming that thing. Okay, so normally when we're in lab, we're going to be having a pipe cleaner that we can sort of bend and push up this way and push up this way, and then we get the idea of how the artery is conducting blood through that system. Okay, so that's that situation. So we'll have a chance to do hands-on things when life returns to the lab, and that'll be a fun deal. Okay, so then we have another pair of nerves going through an opening here, and there's going to be a ridge, and we're going to be dealing with something called the internal acoustic Miatas, or the internal auditory Miatas. Your ear canal really is the external auditory Miatas. So the ear canal is that canal with skin covering it that leads inward to the middle ear, but you have to pass through the tympanic membrane to get there. Okay, so in this picture over here, we have a ridge. This is referred to as the Petrosal Ridge, right here, and we have openings on both sides of that ridge. Okay, and then here they've decided to list 7 and 8 on this side, and trying to determine how they figured this out. But so that's the idea, is that we're going to be going, there's 2 openings here. There's one above and one below, so we're not to confuse that. Notice that the one below is actually an opening between 2 bones, not in a bone. So that's a dead giveaway right there. This is the jugular foramen, and the one up here that actually goes into this ridge of bone, that's the 7 and 8. Okay, and number 8 is very complex. It's actually 2 nerves in one. But let's first deal with number 7, since it's earlier in number. Number 7 doesn't do a whole lot here. It does one muscle in the middle ear called stapedius, and then it travels on. It's in some cases carrying taste for the tongue down through a particular nerve we'll be learning about. But ultimately, it comes out the side of the head, and where it comes out is the Stylomastoid Foramen. So let's see if we have a Stylomastoid Foramen clearly in view here. Right here is a good spot, more or less. Where's our mastoid and styloid? And the deal is is that it's coming out right here, and that it's going to wrap around the front of the ear, and then it's going to innervate the muscles of the face. Okay, it's actually got 5 branches that innervate the muscles of the face. Let's take a look at that right here. The internal acoustic Miatas, cranial nerve 7 facial nerve, muscles of facial expression. Now, I didn't list here that it's going to be traveling through the skull all the way to the Stylomastoid Foramen. So let's take a look at this particular view. Okay. And we're looking underneath the skull here. And we should be able to see there it is. Stylomastoid Foramen is right there. And then it's going to come in front of the ear, and it's going to provide a branching, 5 branches that go to the top of the face, the middle of the face, lower face, and the neck, and provide with all the muscles of facial expression. Now, because it goes through a tortuous pathway in the bone itself, there is a problem with inflammation, especially in an upper respiratory infection, is that there's a chance that we're going to have a condition called Bell's palsy, and the facial nerve will get squeezed a little bit in the inflammatory process, and one side of the face will droop. And that's one of the issues around this facial nerve, is that occasionally it's subject to that inflammatory response, and you end up with this sometimes short-term paralysis. Sometimes it can be long-term, but at any rate, one side of the face is drooping due to paralysis. Okay, so muscles of facial expression, very important nerve, very important muscles. We communicate a lot with those muscles. Okay, so now we have cranial nerve number 8, the vestibulocochlear. The vestibulocochlear deals with 2 things, hearing and balance. Okay, so hearing is, both of these have machinery inside the Petrosal Ridge here. Okay, so we go inside, there's going to be what's called a Cochlear, and that's for hearing. The spiral organ of Corti will be in there, and we'll learn about that next semester. And then there's going to be a vestibular region with static equilibrium, and then there's going to be semicircular canals inside here with dynamic equilibrium sensitivities. And so that's all housed inside this bony structure. And the nerve divides into 2 parts, vestibulocochlear. The vestibular nerve takes care of balance, and the cochlear nerve takes care of sound and hearing. Okay, so then that's number 8. Then we have 9, 10, and 11. 9, 10, and 11 go through this opening. It's a rather big opening, actually. It's between 2 bones, and it's got 9, 10, and 11. And this is going to be glossopharyngeal vagus and the accessory nerve. Okay, let's take a look here. We just did the internal auditory Miatas. Here's the jugular foramen, 9, 10, and 11. Glossopharyngeal, dealing with blood pressure, saliva, taste. Vagus is really busy. It regulates heartbeat, lungs, and the digestive system from the oral cavity all the way down to the large intestines, transverse colon. Very busy indeed. The cranial nerve 11 takes care of just 2 nerves, trapezius and sternocleidomastoid, and we'll get to that when we get to muscles. And then finally we have the hypoglossal canal. Let's take a look at these openings. Okay, we just noticed this is the jugular foramen, and then notice here in the side of the foramen magnum, we have a sideways little opening here for the hypoglossal canal, cranial nerve 12. It innervates the tongue for motor activity. So how did I do that? And I went to the left side over here and put a stirring rod that way. I went over here and put a stirring rod in the jugular foramen. Here is the internal acoustic Miatas, and I used this particular one here on the right for the test situation. And so you'll be seeing this particular diagram at some point. Okay, so here it is that I have how shall I say, I've tricked you into learning the names of the 12 cranial nerves, but it's nice because then certain parts of the skull will have special meaning for you, and I wanted to do that.